We work on glucocorticoid signaling in bone, as we've done that for 15 years or so, starting with endogenous glucocorticoids, that is endogenous physiological levels of glucocorticoids, and showing that those endogenous glucocorticoid levels actually have anabolic effects on bone. With other words, glucocorticoids at normal low levels, and this is all in mice obviously, at low levels have a bone forming effect. With other words, glucocorticoids signal in osteoblasts, activate the Wnt signaling pathway, and tell the mesenchymal progenitor cells to become osteoblasts. It's sort of like the old guys telling the young guys what to do. And that is controlled by normal glucocorticoid signaling. So if you take glucocorticoids out, for example, in a young mouse or in an embryo, in an embryonic mouse, instead of making bone, they make fat tissue. And that is something that we also see in people in some ways. And again, as you know, we need to be very careful in translating mice data or mouse data to humans. But what we do see in patients on high-dose glucocorticoids, that they get obese, they make more fat cells, and they lose bone. But as I said during my talk, this is not a paradox. What it really is just a dose effect. So at normal physiological low levels of glucocorticoids are anabolic, whereas at high doses, or if glucocorticoids are missing, so it goes both ways, if you have too much or too little, they actually are deleterious to bone and result in an increased accrual of body fat. And that's what we see in patients, that's what we see in mice. And that really led us then to the work I've been talking about today, and that is the link between excess glucocorticoids, bone, and metabolism. And again, a word of warning, this is all mouse work. This has not been done in humans, and the evidence in humans in regards to the effects of glucocorticoids on bone and from bone onto metabolism, on glucose metabolism, fat, adipose tissue, there's very, very little evidence, good evidence, in humans. So all we're talking about is mouse evidence, and what we've shown to our own surprise is that if you treat animals, normal animals, with glucocorticoids, with relatively high doses of glucocorticoids, these animals become obese and they develop basically what we would say steroid diabetes. Well, that's something we've seen we see that as clinicians in humans as well. However, if we do the same thing to mice where only in bone cells and only in the bone forming cells, the osteoblasts, if we disrupt glucocorticoid signaling in those mice, and we do this with a little trick that's rather technical and not so important, but if we disrupt glucocorticoid signaling in osteoblasts, only in osteoblasts, and we then treat these mice with glucocorticoids, they don't become obese, they don't develop steroid diabetes. As a matter of fact, they stay nice and lean, they can handle glucose, they have no problems at all, which really sort of creates a new paradigm, if you like. Until that study, everyone, including myself, thought that excess glucocorticoids, be it therapeutic glucocorticoids or Cushing's disease or Cushing's syndrome, that the effects of glucocorticoids on bone, producing osteoporosis, and on metabolism, producing steroid diabetes, are two totally different effects, and they're independent from each other. What we now think is that the metabolic effects of excess glucocorticoids are actually mediated through the effects of glucocorticoids on bone. And we've taken that a step further and gone away from just high-dose glucocorticoid treatment, and taken it to aging. And there's some data I've shown where when we let these transgenic mice and the wild-type littermates age, and aging in mice means 18 months, maximum 24 months, the wild-type mice do what we do as humans when we get older. We get a bit fatter, we get a little bit, we have problems metabolizing glucose, handling glucose, we lose bone. And that's what we see in the transgenic, that's what we see in the wild-type mice, but we don't see that in the transgenic mice. So with other words, the moment you disrupt glucocorticoid signaling in osteoblasts, you completely change the entire metabolic setup of the organism, be it in the therapeutic setting or in a setting of normal aging. And that obviously is quite surprising and sort of leads and invites to speculate what sort of implications this could have for people, for our patients. Some of the work we sort of moved on into normal aging. We are working on the counterpart of what I just said, that is high-fat diet and obesity, and the effect of osteoblast and glucocorticoid signaling in osteoblasts in regards to the effects of high-fat diets on not only bone but also on fuel metabolism. So those are the areas where we're exploring at the moment, and I can tell you that we've found very interesting connections there.